Having oily skin is one of the more common concerns that an individual comes to a dermatologist for consult. It can be associated with enlarged or visible pores, with breakouts, and with seborrheic dermatitis. In this video, I'm going to be talking about why some people have oily skin, what skincare ingredients help control oil production, and other treatments and procedures that dermatologists do. I am Dr. Gaile Robredo-Vitas, your board-certified dermatologist on YouTube. I really try my best to post one video a week all about skin and skincare, and you can also find me on Instagram as Irene Gaile, where I post similar content about the skin. Oil or sebum are produced by your oil or sebaceous glands. These are highly concentrated in some parts of the body like our scalp, our T-zone, our upper chest, and our back. Sebocytes are what we call the cells that make up the glands. They disintegrate and release sebum, a viscous fluid made up of triglycerides, free fatty acids, wax esters, cholesterol, and squalene. Sebum is essential in maintaining skin barrier integrity and in maintaining moisture in our skin and hair. It aids in lubrication to prevent mechanical friction, and more recent studies show that it also aids in the delivery of antimicrobial lipids and antioxidants in the form of squalene, coenzyme Q10, and vitamin E. Sebum production varies throughout the course of one's life. So, iba yon pag bata ka, pag teenager ka, and as you get older. Androgen hormones, particularly your 5-alpha dihydrotestosterone or DHT, play a major role in sebum production. A healthy adult is said to have a sebum production rate of 1 mg per 10 cm square of skin every 3 hours. Kung bumaba siya to less than 0.5 mg per 10 cm squared, you can have dry skin. But if this rate exceeds 1.5 mg per 10 cm square of skin, that's when you have your seborrhea or oily skin. Excess oil for some patients can be unpleasant and uncomfortable and can lead to enlarged or visible pores, sometimes a shiny, greasy appearance. Now, what causes increase in sebum production? There is really no clear explanation as to why sebum production differs in each individual, but there are certain factors that can explain why some people have more oily skin than others. First would be genetics, which is said to play a major role. So, kung meron kang relative or relatives that have oily skin, you are more likely to have the same skin type. Second would be hormones and gender. So, men in general are said to have higher sebum output rates compared to women due to their higher testosterone levels. Third would be season and environment. Several studies describe an increase in oil production during the spring and summer and in more humid climates. Fourth would be ethnicity. In terms of race, for instance, Chinese women have noticeably smaller pores and lower density compared to African Americans, who are said to have more visible pores or bigger pore sizes and more oily skin. And number 5 would be certain conditions that lead to or are related to increase in your androgens, which can therefore also increase your sebum production. Now, what can we do to control excessive oil production? Luckily, there are many things we can do and give that can transform a shiny and greasy complexion into fresh, dewy, glowing skin, keeping oil under control. Now, let's start with ingredients. First would be those that are oil controlling or regulating. Number 1 would be your niacinamide, also known as your vitamin B3. Niacinamide has been proven to regulate oil production. In a double-blind placebo-controlled trial by Draelos et al. On 100 patients, topical 2% niacinamide significantly lowered sebum excretion rates after 2 and 4 weeks of use. In addition, it also supports the skin barrier by helping it retain its natural moisture, calms inflammation and redness, and improves pigmentation. Second ingredient would be your retinoids. I'm sure that a lot of you are familiar with it. The topical retinoid family is made up of retinol, its natural derivatives like retinoic acid, retinaldehyde, and retinol esters, and some synthetic derivatives like your adapalene and tazarotene. Retinoids are commonly found in many anti-aging and anti-acne formulations. When used regularly and consistently, they help reduce the appearance of fine lines and wrinkles, improve age spots and hyperpigmentation, and even help control oil production. Retinoids' effect on the skin happen via their interaction with certain nucleic acid receptors. And in vitro, it has shown to significantly decrease sebocyte differentiation, proliferation, and production of sebum. Third ingredient would be salicylic acid. I know that a lot of you are familiar with this also. Salicylic acid is an oil-loving anti-inflammatory acid that is excellent for those with oily and acne-prone skin. Once in contact with your skin, it breaks down dead skin cells, goes deep inside your pore, clearing out dirt and debris, and dissolving keratin plugs and comedones or your blackheads and your whiteheads. Fourth ingredient is glycolic acid. It is an alpha-hydroxy acid which is known to break the bonds that hold skin cells together, removing and sloughing off dead skin cells, revealing new ones from underneath. In this way, glycolic acid can help prevent excess sebum production and also prevents buildup of dead skin cells, debris, and dirt on the skin. So guys, before we move on to the next ingredient, if you are still watching this, I hope that you find it informative and that you will hit the like button. Also, please don't forget to click subscribe if you want to continue to receive information about the skin and skincare. Ingredient number 6 is green tea. Now, personally, I'm a lover of green tea. Kahit anong green tea gusto ko. Chocolate, muffin, cake, basta green tea, kakainin ko yan. A small-scale study had patients apply 3% green tea emulsion for 8 weeks. On evaluation, there was a significant decrease in oil production compared to baseline. Another slightly larger study also found significant decrease in sebum secretion after 6 days of using a topical green tea emulsion. And last or 7th ingredient in the oil regulating or oil controlling category would be L-Carnitine. I would often associate L-Carnitine with weight loss or, slimming, but it is actually something that we naturally produce in our body and surprisingly is a potential ingredient that can reduce the appearance of oily skin. It does this by augmenting the process by which free fatty acids are broken down. While more studies are needed to evaluate its efficacy, topical 2% L-Carnitine has been shown to significantly reduce the amount of intracellular free fatty acids within the sebocytes, therefore leading to significant sebum production. Now we move on to ingredients that are oil-absorbing, starting with your green bentonite clay. Clays are known and have been used as oil-absorbing ingredients, and there are many formulations available. Often they are sold as masks made up of different types of clays. The most popular kind in my opinion would be the green bentonite clay. I'm sure nakita nyo na yan sa mga beauty stores, which is derived from volcanic ash. It has strong absorbent properties due to its low moisture content and is very helpful in those with oily skin. It also aids in unclogging the pores so that they appear smaller. The second oil-absorbing ingredient would be charcoal. In Tagalog, uling. It is a porous black material made up of carbon obtained by charring organic materials in the absence of air. Activated charcoal is the one that is used in medicine and in skincare, treated to increase its absorbency. Charcoal is useful in oily skin because of its ability to attract and trap substances it comes in contact with, and also because it is able to absorb excess oil and other pore-clogging dirt and debris. Now we go to other ways of controlling oil production, starting with dimethicone. Dimethicone is present in certain skincare products like your moisturizers and makeup primers that give your skin a smooth, satin-like finish. In addition, it gives you a mattifying effect, which is ideal and desired by those with visible pores and oily skin. It also forms a protective layer on top of the skin, which helps lock in moisture. Next, we go to systemic treatments. Prescription medications such as your isotretinoin, your spironolactone, and oral contraceptives have sometimes been used to control excessive oil production related to increase in androgens. They should never be taken without the guidance and recommendation of a licensed physician. And last but not the least, we have procedures. In clinic procedures such as your botulinum toxin injections, your photodynamic therapy with ALA, and laser treatments are sometimes used to improve oily skin. According to the American Academy of Dermatology, and I quote, "Oil preserves the skin. What is important is to strike a balance between having too much oil and maintaining your skin's natural moisture." Unquote. Maraming options that exist in the management of oily skin, with each having its pros and cons. It is recommended that individuals with excessive sebum production, not controlled by topical creams or ingredients, seek the consult of an expert in skin, such as a board-certified dermatologist. In this way, your skin can be properly assessed, and you will be given treatments that are personalized to your needs and preferences. So that's it about how to control excessive oil production. I hope that you find it informative and helpful. If you have other comments, questions, suggestions, or you would just like to share anything, feel free to put them in the comment section below. And again, please don't forget to hit the like and subscribe button. I'll see you again soon. Bye!